Thank you. Sorry for the delay. I'm going to start with the latest COVID numbers here in Massachusetts and Boston. In Massachusetts, as of yesterday, 222 new confirmed cases, bringing the total to 121,446. 121,046 confirmed cases. There were 8 deaths reported, bringing the total to 8,925. Boston's numbers, I just got them as I came down. 25 new cases today, bring our total to 15,967. We had no new deaths in the last 2 days, and our death total remains at 754. We've had a full week now without deaths, which is very encouraging here in the city of Boston. And I want to just say to our thoughts and prayers go out to all the families that are still sick and suffering from COVID-19, and all the families that lost loved ones. You're in our thoughts and prayers. The trends for the week ending September 1st, the citywide positive rate is down to 1.7%. That's down from 2.3% the week before and 2.7% the week after that. So we've seen now a couple of weeks of decline, which is a good thing to see. Our cumulative positive rate since the beginning of the pandemic, at one point we're up in the 40s, we're down to 8%. Our ER visits for COVID symptoms remains low. The number of COVID patients in the ICUs also remains very low. To give you a sense of what it looks like, as of yesterday, there were 11 COVID patients in intensive care in Boston hospitals, only 11 total in all of Boston's hospitals. That's down from our peak in April we had 571 people back in April. And certainly we've come a long way as a city in that case as well. I want to thank every single person for your part in playing and getting our community through this very difficult time. Testing, ending September 1st, we tested an average of nearly 3,000 people per day. If you notice, over the last month, our testing went from about 1,500 people a day to 3,000 people a day. Much of the increase due to testing is colleges. They're doing students that are coming back on campus, so our numbers have gone up dramatically because of that. But even last week, we're averaging over 2,000 tests per day. That's going to increase the testing numbers in neighborhoods where more students live, and certainly in the Fenway, in Back Bay, in Roxbury, Mission Hill, and Allston Brighton. We're going to start to see those numbers really get high there. One more thing to know, colleges are testing students repeatedly, to monitor the information, so they're not just getting one test, it's a constant. I believe they're doing a test every 5 days or so of all their students to check them to make sure that they're okay, and many of them are using technology to track their students as well as their staff to make sure anyone that tests positive, we're able to jump on it and keep the spread from potentially happening here in the city. We only count each person once in the numbers we collect. So when you think about the numbers per week, if somebody was tested twice, for example, if I was tested twice, it would only be regarded as one test in the number of tests. We want to make sure this way our numbers will not look artificially low due to repeat testing, and we can maintain an accurate sense of the virus, in the presence of the virus in our city. Outside of the work the colleges are doing, we continue to maintain our increased testing capacity at community health centers, in the City of Boston mobile test sites, and we continue to bring additional testing capacity and other resources wherever it's needed in whatever neighborhood that needs it. Anyone, if you're looking to find out where you get tested or where you can find in your neighborhood or close to your house, we're asking you to boston.gov/coronavirus. That's boston.gov/coronavirus for all the testing sites in the City of Boston, which includes the mobile van. East Boston, we have some concerns about East Boston, and I want to give you an update on East Boston. East Boston neighborhood remains the neighborhood with the highest positive rate. We've been targeting outreach and resources there since the spring. We've been in conversations with dozens of community organizations throughout this pandemic to share information and to respond to the needs that are asked for. 3 weeks ago, we launched an elevated outreach plan to East Boston to address new increases in case data. The Boston Public Health Commission is working with several city departments as well as with elected officials from East Boston. We've distributed over 2,000 COVID-19 kits with cleaning supplies and information throughout the community. We're providing them to residents and businesses in multiple languages across the neighborhoods. We're also partnering with the churches, and we're especially focused on helping people in households with multi-generational households, I should say, to learn strategies and get resources for limiting the spread, something that's really important for us to do. Now we're starting to see those numbers go down in East Boston. 3 weeks ago, the positive test rate, and I reported here, was 11.4%. As of September 1st, it's down to 8.7%. So that's a good way to see the numbers going. We want to continue that downward trajectory, if you will, over in East Boston with testing. We continue to bring resources also to our neighborhoods. Our mobile testing team moved from Central Square Park in East Boston on September 2nd and will remain there through this coming Saturday. So anyone in East Boston that wants a test, or anywhere in the city, but if you're in East Boston, Central Square Park, you'll be able to get testing there. The mobile testing site is free, and it's open to anyone regardless of your symptoms. You can call 311 or visit boston.gov/coronavirus to pre-register. I want to also give a special shout out to the East Boston Neighborhood Health Center for the testing work they do, and their partnership with operating mobile testing teams. East Boston Health Center was one of the first health centers, actually I think it was the first one, to step up and help us in a big way with providing testing, and they've been a leader here in the city, and I want to thank them and their team and their staff for doing amazing work. I want to again make it clear that anyone can get tested regardless of immigration status. East Boston is going in the right direction, and we're going to continue to make all the supports available to bring that number down. Across the city, we're going to keep working to provide testing, guidance, information, and support whenever it's needed, and we're going to keep asking everyone to work together. We can help keep ourselves and your family safe and help keep your city moving in the right direction for a healthy, equitable recovery. We're asking people to continually wash hands, avoid large gatherings. We saw one over this weekend, a large gathering in, I believe it was in Dorchester. We're asking people, those are dangerous. Those are dangerous not only to have the large gatherings, but they're dangerous for you. They're dangerous for people around you. If you're asymptomatic and you don't know you're carrying the virus, you can get other people sick, or people around you that might be asymptomatic can get you sick. So we're asking you to be very, very careful there. We're asking people to stay 6 feet away from each other. If you're going for a walk, have your mask with you, and if you see somebody, put your mask on. If you're in the same general area, if you're walking, try and avoid contact with people. Constantly, we're asking people that make sure your mask is with you. If you operate a business, we're asking you to follow the guidelines and make sure that your employees and customers can follow them as well. And I would suggest that if you haven't had a conversation with your employees a little bit about COVID, have the conversation now, because I think a lot of people are still very concerned about COVID-19 and the impacts of it. If you're a college student, we're asking you to follow your college guidelines. If you live in a large household with multiple generations, we're asking you to be extra cautious. That would be a mother and a father and children and grandparents, or a grandparent living in a house, or aunts and uncles. We're asking you to just be careful there to make sure that everyone in the household stays safe. I certainly understand the need to socialize, but we have to stay in small groups, keep distance, keep wearing masks, meet outdoors as much as possible when you're meeting, and that goes for anyone and everyone. And if you've been to a party or a gathering of any kind, I want you to assume that you've been exposed to the virus. So we're asking you to get tested to protect yourself and protect your family. Again, you can go to any one of our testing sites to do that. COVID-19 is still very much with us, and we're asking people to use precautions that we've been taking and continue to take those necessary steps. This is how we'll continue through the recovery to make sure that people are safe and that people get back to work and our kids can get back to school. The economic impacts is also still with us, and it will continue to make life difficult for many residents here in the city for a period of time. We continue to provide free meals to our youth, to our families, to our seniors, relief and protections for renters and homeowners, resiliency fund investments in our community. We're advancing a range of actions on racial equity, and we'll provide an update on new announcements on the work over the next coming weeks on what we're doing here in the city of Boston to enhance the work we've done. We're going to continue to look out for ways that we can adjust our city services to ease the burden on residents in a very difficult time. The Boston Public Libraries have been an essential source of support to our residents. We recently launched a free outdoor Wi-Fi at 9 branch locations. We've reopened safe public computer access at the Copley Square branch. And our BPL To Go program allows you to borrow books and materials at every branch across the city of Boston. Since launching BPL To Go, over 94,000 physical items have been reserved. That's since June. 94,000 physical items have been reserved. Over 131,000 items have been circulated when you include online materials. And since March, roughly 9,400 patrons are using library services every day. So our libraries are still very popular in the city of Boston, and we want to continue to create access to as many people for those services. In March, the Boston Public Library also put a moratorium on late fines for borrowed items. We didn't want people to leave their home unnecessarily because they were afraid of getting a library fine. And that remains the case. And today I can announce that the Boston Public Library will extend that moratorium on late fines to the end of the calendar year. The extension applies to all adult library card holders at all BPL branches. As a reminder, all patrons under the age of 18 are already exempt from late fines by policy that the Library Board of Directors did, I believe, a year and a half ago. I wanted to make a special shout out and thank the Boston Public Library President David Leonard for his proactive leadership in making our libraries a vital and equitable part of our pandemic's response. We're over a week into September, which means time is running out to complete the 2020 U.S. Census. The last day to respond is September 30th. As of today, 57% of Boston households have self-reported. That's lower than we've had in previous decades, and we have extra time, although it's in the middle of a pandemic. It's largely due to our pandemic, but we need to get those numbers up regardless. The count happens every 10 years. The impacts for federal representation, legislative districts, the amount of federal funding Boston receives for critical services like health centers, schools, affordable housing, senior services, and much more are on the line. The Trump administration decided to cut the count short by a month. That will hurt historically undercounted communities, including immigrant communities and communities of color here in Boston and all across the United States of America. In response, we have joined a coalition led by the National Urban League opposing this decision, and we signed on to an amicus brief challenging it. This will play out obviously in our court systems. In the meantime, we can help make sure that your community does not lose on representation and funding in the next 10 years. It's been estimated that for every resident who doesn't fill out the census, we will lose $2,400 in Boston in funding every year for the next 10 years. Those are the resources our community need and deserve. So I'm asking you, please fill out the census. Go to my2020census.gov. You don't need a number. Go to my2020census.gov. You scroll down. It's pretty simple to do. I'm asking the people in front of me, including the press, to make sure you do it if you haven't done it yet, because it's really something that always kind of slips our mind. It literally takes about 2 minutes to do. If you've done it already, make sure your family and friends and anyone you know have filled out the census. If you have not responded, you may receive a visit from a census employee at your door to try and help you fill out the census. There are people knocking in our neighborhoods right now, and they have information on them saying that they're from the census. If you don't want or need another visit, just simply please self-respond online or over the phone. If you do that, then your name comes off the list and no one will be knocking on your door. The two ways to do it is visiting my2020census.gov. That's my2020census.gov, or calling 844-330-2020. That's 844-330-2020. We're asking you to do that today. I want to briefly, because I'm going to have the Commissioner come up here in a second, address the shootings and incidents of violence that took place over the long weekend here in the city of Boston. As I've said many, many times before, one act of violence at any time is unacceptable. Our goal is always to get to zero. My heart goes out to the victims and the families and the communities who were harmed over this weekend. It is not unusual for Labor Day weekend, so we had a cross-departmental planning and outreach in place. We had a team of agencies and dedicated individuals working together on both prevention and our response. Our Office of Public Safety, our street workers on the SOAR team, the Neighborhood Trauma team and the Boston Public Health Commission, the safety teams at the Boston Public Schools, the Boston Police Department, along with partners at Boston EMS and Boston Fire. I think State Police as well, let the Commissioner address that. Hospitals are also an important partner in this work. We worked with 5 different hospitals this weekend to get resources to victims and their families. We have to bring every available resource to what we're experiencing here with the violence in the city. We've added 15 mental health clinicians to the BEST team in this year's budget to respond to mental health calls with treatment and resources. Those BEST clinicians are new, and they're already helping another complement of BEST clinicians around the city, so they've been out there working in our streets. And we're dedicated to eliminating the root cause of violence, including poverty and systemic racism. I'm going to end by talking about Recovery Month, but before I get to Recovery Month, I'm going to ask Commissioner Gross to come up and say a few things about this weekend.
Thank you, Mayor. Good afternoon, everyone. Commissioner Gross here. Yeah, it was a long Labor Day weekend. First, I want to thank the communities for you even to pick up the phone and call 911. You definitely helped us make some gun arrests, and you definitely helped us to facilitate investigations pertaining to 12 independent shootings. Why do I say independent? At this time, our investigations reveal that none of the 12 shootings are connected at this time. But again, thank you to the community that helped out, again, with these investigations and arrests. You heard the mayor allude to the agencies that were also out there with the BPD, the Boston Public Health Commission, as well as Boston EMS, the Boston Fire Department, SOAR, and our Boston Neighborhood Trauma teams were instrumental in helping to keep the peace, as well as provide services to the victim. Folks, we have over 560 guns off the street. The arrests we're making, the people that we're seeing committing the crimes are a part of the same group, and you've heard me say it over and over again. The same repeat violent offenders committing the crimes. So again, I never get disheartened. It just strengthens our resolves to keep working with the partnership that I just alluded to, and specifically the neighborhoods. So again, it was a long weekend. And instead of being hypercritical for some folks, get out there and talk to your constituency. Because a lot of the kids that are involved in shootings or in drag racing or fireworks are a part of your constituency. The police can't wear all the hats. We need everyone to do their jobs, not point fingers. Get off the fence, go out and talk to the people. You heard who I alluded to. We're out there. We just need other people to be out there. And we definitely welcome the courts to reopen. You know, there's the COVID-19 situation that prevents them from doing so. But whether it's virtually or until that time, we need the courts to be open. Because these individuals causing violence in our neighborhoods should be locked up. That's why you have 12 shootings within 3 days. It's the same individuals. There has to be some accountability. So, that being said, I'll take any questions. But thank you again to the neighborhood. You're showing people that, again, you're not desensitized to violence. You're picking up the phones. You're giving us hints. You're giving us help. So thank you. We have to continue our fight against violence. Okay. Thank you.
And I'll bring the Commissioner back up for any questions you have right after. Just one more point here, and then I'll open it up. September, first of all, I want to thank the men and women of the police department as well for this weekend. They were out in the neighborhoods making sure that everyone had a safe experience. And I agree with the Commissioner when he talks about the courts are open, some are open, not as open and not as full as they have been, and I understand it's COVID-19, but it really is important that we address some of the folks that are doing the shooting in the city of Boston, that we get a process moving, working with the Commissioner, working with the District Attorney, working with the courts, because it is, we have seen an uptick in shootings this year. We've seen an uptick in homicides this year. Some other crimes are down, but it's really important that people understand that we send a very strong message that if you do something bad in the city, that you will be brought to court and prosecuted by the appropriate authorities. So just want to add that on there. September is Recovery Month. For many of us, every month is Recovery Month, but this is an important time to raise the awareness and help people get the help that they need and the supports that they need. It's a time to celebrate the millions of Americans and thousands of Bostonians who are in recovery, and I want to commend you a day at a time, and God bless you. It's a time to remember those who we lost to this horrible disease. I lost a young man that was a I coached a couple weeks ago, pretty difficult. It's time to be grateful for the treatment work and workers that they're doing to save lives. Every year this month we have a series of events. This year those events are being adapted to our current conditions. They include the Massachusetts Opioid Screening and Awareness Day on September 22nd. On September 23rd, the Massachusetts Organizations for Addiction and Recovery and Friends is holding the 30th Annual Recovery Month celebration. That's more. On September 29th, we're holding a virtual panel to discuss our new Project Opportunity program. It also supports the people with query reports and getting employment, and that's a big part of recovery, helping people. We're asking people to visit boston.gov/recovery to learn more. And this certainly has been a very tough year for everyone, and especially those who are struggling with addiction or in recovery. If you need help, services are available and ready for you. Treatment professionals have remained hard at work throughout this entire pandemic and continue to. Our programs are taking COVID precautions. They have been successful in keeping people safe, and they have plenty of capacity right now. You can access the care you need. You can call 311 or talk to a placement coordinator. We're asking you to reach out for help. If you're not sure if it's what you need, we're asking you to reach out anyway. If you're not sure, if you're not quite there yet, just make that phone call. Take a day at a time. I was on a meeting last night, a Zoom meeting, and what I was happy to hear that there were several people that came into recovery during the pandemic. And what I thought was a lot of people wouldn't understand how to access the recovery programs during this very difficult time with meetings not being held in person. So I'm just telling people out there that if you're suffering in any way, whether it's through substance use disorder or you're just having stress, call 311. We set up counselors. We set up a line for you to be helped, get help. This is still a very stressful time for a lot of people. You can feel it when you're out talking to people. So we just want you to get the help you want. Life's a day at a time. And with that, I will turn it over to questions. I have a question from Sean Carter, but I think you want to ask me or want me to read it? Okay, only one submitted question was from Sean Carter from the Boston Herald, asked about the Civilian Review Board. Earlier this summer, as we all know, we formed a task force charged with making recommendations how we can eliminate systemic racism and make lasting changes in our police department, continue the reforms that we started several years ago. Part of what the task force has been reviewing is the Boston Co-op Board to determine how we can strengthen it to better meet the needs of our residents, or do we even look at a different system? I'm going to be brief this week to talk about that. In the coming days, the task force will move and to have more to share about their work and their recommendations, how they move forward. The recommendations were supposed to be in a couple weeks ago. But at the beginning of the task force, when they came back to me, they wanted to expand areas of research. So we gave them that ability to do that. They were grateful for that, and they're going to come back with some more recommendations. I don't have the areas. I did mention it here at a press conference a few months ago that they expanded that. I don't have those areas, but we'll be able to see those over the course of the next week or so, I think. With that, I think that's all the questions I have on. Yeah. Okay. If you want me to, I'll address it for you. The question is, not by a reporter, but by a citizen, about the special needs in the city of Boston and not having services in our school department from March 17th, I believe, when we closed school down. And unfortunately, in March, we had to close school down because of the pandemic. Every school, just about almost every school in the country, but every school in Massachusetts went remote. And as we work through the summertime, as we think about reopening school, the very first phase of reopening school, the first in-classroom learning we're going to have in our classroom are going to be special ed kids. Okay. Yeah, there was outside placement on programs, no question about it, but we're talking about when we're bringing kids into our schools, we want to make sure the parents can opt in. So that's what we're going to do. I'll talk to you after. I'll talk to you after this press conference. Okay? I'll talk to you right out in time. Okay, I'll talk to you. I promise you, I'll talk to you right after this. I'll talk to you right after this. All right. That's a valid concern. I mean, I think we have a lot of concerns around our schools. With we did some polling of our parents. About 50% of the district that we've polled, 67% of them, want to be in-person learning. 50% want to do hybrid learning or remote learning. It's a tricky situation for all of us. We need to make sure that we keep our teachers, our students, all of our staff healthy and safe. And unfortunately, we're in the midst of a pandemic, and I think that that's something that certainly I would not. I'd rather be starting school on Thursday, all in classroom, but unfortunately, we can't at this point. Yeah. No, I'm talking about the task force.
Right. So you're focused on the task force, but specifically on the topic.
I'm assuming we're going to have a conversation. What the task force came back with recommendations and what Council Campbell and the council is talking about today. I have not seen their version yet, so we're going to be. I'm getting my briefing from the task force on Thursday.
Do you have a timeline for?
Yeah, I think there's a timeline that's laid out. I'm not sure exact date. I think it's within a week or two, right after. It's a quick timeline.
Okay, the timeline for the launch of the task force?
No, task force is done. They are going to present. I believe there's going to be a public testimony. I think they're taking it in this week, next week, this week, and then once the public testimony is in, then they're going to make recommendations to me.
Mr. Mayor, I'm interested to know your reaction to our councilwoman when she called you to tell you that she was going to run for mayor.
You know, right now, I'm focused on running the city. And seeing us through the COVID-19 crisis that we're dealing with here in the city of Boston. As you can tell, we're talking about reopening of schools and working on reopening schools. We want to make sure that a lot of the essential workers and people that are working in the restaurant industry that are losing their jobs and losing their employment, that they don't continue to lose their employment and creating new jobs. We want to continue to fight for equity. As you heard, we have a task force. So my job right now is focusing on being mayor of the city of Boston. When I'm not on duty as being mayor, my job is working to elect Joe Biden and Kamala Harris as the President and Vice President of the United States of America. We need an administration in Washington, as you can see, that we can work with for the next 4 years, unlike the current one that's in there today. Unfortunately, throughout this pandemic, I've been saying at this microphone, spending too much time talking about the lack of leadership in Washington, D.C., and having a president and a vice president that understands the value and the importance of having a relationship with cities in America, and most importantly for me, Boston, is really important. So that's what I'm focused on right now. There'll be plenty of time to have conversations. We'll talk about that at some point. I didn't go to the Globe. Any other questions? A reporter from the Globe asked me the question if I had received a call. He had heard that I got a call from the counselor, and I just confirmed I did.
Why did you say something?
Because I don't remember that one. When I say no comment to you guys and I know an answer, it's pretty not fair to do.
So you want me to answer about why you
I was asked a question by a Globe reporter.
I asked you plenty of questions.
No, I've answered every question you've asked me, almost every single one, Karen. That's not fair. That's not fair, Karen. I answer every question just like I'm doing right now, and you're attacking me on this. You are. No, you are, and I answer every question you ask me all the time. I never dodge questions. Yes. Yeah. Well, if I don't have the answer, absolutely, absolutely. Any other questions? Any other questions? All right. Thank you. I'll talk to you guys sideways. Press. This is press. Press conference. I'll talk to you later. Yeah.